So pap smears are a great way to screen for cervical cancer. They've been around for years. It's probably one of the first tests we actually have for cancer, especially in women's health. It is the test, besides mammograms. Starting at age 21, they used to be yearly, now they're every 3 years, starting at 21, and every 5 years, starting at age 30. So it's not as frequent as it used to be. But the main key for us to help prevent cervical cancer is actually the HPV vaccine. So we do know that cervical cancer and some other cancers related to HPV are related to the virus. And if you have a vaccine to help prevent the virus, we're seeing less cervical cancers. And I see that even to this day, I see less and less cervical cancers, which is great. And I always talk to the patients first, show them the instruments we use so they're comfortable, and what to expect. And then when I do the pap smear, I talk them through that, and make sure they're comfortable, and that if they're having pain, we always adjust accordingly. But really, it doesn't take a long time, but it's a good test to go through. Sometimes we do bleed after pap smears for a few days, and you shouldn't worry about it. Yeah, sometimes you could take some anti-inflammatory medication like Advil, Aleve, or ibuprofen. That might help a little bit. So yes, women who are postmenopausal do need a pap smear technically until age 65. Now, if you've had a history of pre-cervical cancer, then sometimes that is a little bit longer. So typically, if you've had a hysterectomy, most women do not need pap smears anymore. However, if you had a hysterectomy and you had a known history of pre-cervical cancer, then you would require pap smears of your vagina. Nowadays, actually, you can have your pap smear during your period. About maybe 10, 15, 20 years ago, not the case. But with technology now, they can rinse away the blood and they can see the cells that are necessary. So that's a good question. Typically, we do recommend it starting at age 21. There are other conditions we might find when we're examining a patient that it's important to know. So it is important to have a pap smear and a pelvic exam. To learn more, please click on one of the links on the screen or in the description below.